What's my cue?
Hey bestie, it's Kati Wasserman. I am a mom, an esthetician, the owner of Flagstaff Skincare Med Spa, and Prickly Bear Skincare, a post-hair removal line. I started Beauty Talk Confessions because honestly, I got tired of how fake the beauty industry can feel. The conversations that happen between wax strips, peels, and facials that no one ever talks about publicly, we are gonna go there. So grab your coffee, get comfy, and let's peel back the layers, one confession at a time. Welcome to Beauty Talk Confessions, where the secrets come out and the glow gets real. Welcome back to Beauty Talk Confessions. I'm your host, Kati Wasserman, and today's conversation goes far beyond beauty. We're diving into what true personal women's healthcare should look like, especially in the stage of premenopause and menopause, where so many women feel overlooked and unheard. In this episode, I'm sitting down with Dr. Michelle Gordon, a board-certified expert in obesity medicine, lifestyle medicine, and general surgery. After building a multi-million-dollar surgical practice, she walked away from the operating room and pivoted into something women desperately need more of: personalized, evidence-based care for midlife health, hormones, weight, and longevity. Dr. Gordon now works exclusively with women through telehealth, providing a level of support that's rare in traditional medicine. No rushing, no gatekeeping, no dismissing symptoms as just aging. Instead, she brings clarity, compassion, and real solutions for women who want to understand what's happening in their bodies and actually feel like themselves again. In this episode, we dive deep into menopausal care, hormone replacement therapy, weight changes, and the emotional toll of navigating a medical system that wasn't built for women in the first place. And at the heart of it all, we talk about what true personal care looks like. Care that sees you, listens to you, and helps you make informed decisions about your body and your future. If you've been craving real answers about your hormones or midlife transition, this conversation is going to give you so much relief and validation. All right, let's get into the conversation with Dr. Michelle Gordon. Welcome back to Beauty Talk Confessions. I'm Kati Wasserman, and I'm here today with Dr. Michelle Gordon. She is a board-certified in obesity medicine, lifestyle medicine, and general surgery. She is also a telehealth innovator. Thank you so much for being here today, Michelle.
Thank you for having me.
I appreciate it. Well, I am so excited for this conversation today. Michelle is an amazing surgeon, and she is going to be one that I know she's going to hit our audience really, really well today. So she has built a successful surgery practice and has chose to focus on midlife women specifically. So I'd love to learn a little bit more about why you focus specifically on midlife and how you kind of got to this point of where you're at right now.
So I was in surgery for 20 years, and in the pandemic, I actually closed my practice. I grew it to 5 surgeons, including myself. And then I left surgery, actually. So I'm not working in surgery now. I do obesity medicine, lifestyle medicine, and menopause care, perimenopause, menopause care, primarily through telehealth. And the reason why I chose menopause was because menopause was really very disruptive for me. Almost overnight, it felt like I gained like 30 pounds. I had lost a bunch of confidence. And I don't know if you ever met a surgeon before, but surgeons are really pretty confident.
Yeah.
And so I lost a lot of confidence. I was having trouble with remembering things. I had a couple of frozen shoulders. It was just really a difficult time in my life. And at the time, we still weren't really doing hormones for women. That was early 2000, late 2010s, like around there when I hit menopause. And it was there was still a lot of question about hormone replacement for women, which has now all been cleared up. And so I didn't take it, and I didn't really ever start feeling like myself again until I got on hormones, and it was, another 5 or 6 years. But I kind of had to white knuckle it through perimenopause and menopause and try and figure out how to manage my lifestyle without having hormone optimization because of the data that was wrong. And if you want me to go into what happened, I can. But
yeah, if you could go into a little bit more detail, I would love that.
So The largest health study of women is called the Women's Health Initiative, and it enrolled thousands of women. And the lead investigator had a bias, and his bias was women should not take hormones.
Yeah.
And what happened was he saw something in the data that confirmed his bias. Okay, so he had what's called confirmation bias, and in science that's bad, because when you want one thing, that's all you're going to see. And when he saw that, he went to the press instead of going through proper peer review channels. So if in about 2003, the press went alive with hormones cause breast cancer.
Oh, yes.
Now, in the retrospective look at this study, the average age of the women who were enrolled into the study were about 62. All right.
Okay.
So that's already well past time to see what would happen with hormones. And then on top of that, the type of hormones they used are not bioidentical. They used a progestin, not a micronized progesterone, and they did not use bioidentical estrogen. And so what we know from recent research is that hormones don't cause breast cancer.
Yeah.
And it depends on the type of hormone that you use and that sort of thing. But almost overnight, about 40% of women in the U.S. who were in menopause were taking hormones and were taken off of them. So it went from 40% of the women, and if you think about it, we're about half the population.
Yeah.
And so, at any given time, there's about 60 to 70 million women in menopause in the United States.
Oh my gosh.
And if about half of them were on hormones and then all of a sudden they weren't, they all had to abruptly go off of them. It was bad. It went from about 40% of women to about 0.4% of women. And so it was all because this one guy had this belief. And it goes to show you that beliefs are powerful.
Yeah. Beliefs are really powerful.
Yeah.
When the menopause study and just the education that we are learning now is so important, but crazy also in certain ways that a male was, I don't know, voicing this study and things like that. I understand that there's male and females that are going to be very important in both kind of aspects, but I feel like it's a little bit interesting and something that important and so female driven to have a male that powerful and have people really believe it and be a direction that wasn't true at all.
Well, and we're still undoing it. We're still undoing all the damage that announcement did. And even when I see patients every day and women come to me and say, well, I heard it causes breast cancer. I'm like, hormones don't cause breast cancer. Transdermal estrogen does not cause blood clots. I mean, there's no evidence for that. And yet, and in medicine, we want to be evidence-based, right?
Yeah.
It's all about evidence. It's not about how you feel today. Right.
Yeah.
We treat your feelings. We treat how you feel, but we don't treat based on how you feel. We treat based on what we know from evidence, what we know works for people. The biggest issue, I think, with the American medical system and probably the whole system in general is that it was built by men for men.
Yes.
And I say this a lot, but if men had a situation in their aging where their testicles shriveled up and their penises fell off, there would be a treatment for it.
Yeah, there would be. Well, and also it's not just that. There's so many deeper issues and also deeper things that come from going through menopause, the mental side of it, the body changes, health issues, like you were saying. And then I feel like physical changes that happen as well.
Yeah, it's true. I mean, what happens to women in menopause? I mean, I've surveyed over 50,000 women in menopause, and number one, the biggest complaint is I'm gaining weight. That's the number one thing. But then after that, it's I don't feel like myself. I don't have any libido. Everything's dry. It hurts now. Difficulty with orgasm. There's a lot of it's very nuanced because estrogen, progesterone, and testosterone hit all of our systems. So it's not just our ovaries, and it's our brains, it's our hearts, it's our bones and our muscles. So all of the things. And so if you wake up, if you wake up one day because you're not sleeping at night, right? You're waking up with sweating and going back to bed and having racing thoughts and all that. That's all estrogen withdrawal.
Oh my gosh. Well, and
Yeah.
that's so hard to then go on with your day the next day, have that kind of start. And it's just a buildup of having things be stressful and anxiety and everything else.
Yeah, and then you get the brain fog from not sleeping, but you get the brain fog from estrogen withdrawal, and you don't know which, and then you crave carbs because you're already so tired. Just that's what the body does. And so
Yeah.
then you eat food that piles on the pounds because that's the physiology.
Yeah.
And if you don't address the physiology, you can't really address the root problem.
Yeah. I agree. With people that are going through menopause that you've experienced and that you've been able to work with, or women that are going through menopause that you've been able to work with, do you find that they reach out to you at the beginning? Are people reaching out at the beginning stages of menopause with the awareness that we're seeing this day and age? Or is it more when they're like having intense issues and they're really struggling that they're reaching out and looking for some sort of relief?
It's really, it runs a gamut. I see women who start to feel a little bit off and want to figure out what it is. I think there's a lot more awareness now around menopause, and so I'm seeing younger and younger women. I see a lot of women in their 40s now,
Oh, wow.
whereas before it was the average age of menopause in the United States is about 51.
Yeah.
And in your 40s, menopause is when you haven't had a period for 2 years, but in your 50s, it's when you haven't had a period for 1 year.
Okay.
And that's ACOG. That's what ACOG says. That's American College of Obstetrics and Gynecology, which
Okay.
I am not a member, but I do follow some of their protocols.
Okay.
So what happens is as you start having estrogen withdrawal, as your ovaries start to fail, you start to notice things are not feeling right. You might be having some mood swings. You might be having some brain fog. You might think you have dementia. And this is when we start to see people like looking for some help. And the problem is that your labs are normal during this time. The
Okay.
labs, and we always want to know when your last menstrual period is because we cycle our hormones. But at the end of the day, during perimenopause, almost all your labs are going to be within normal range. And so not a lot of doctors are going to want to treat.
Yeah.
Now, is it the doctor's fault? No, it's not their fault. The system failed them. The system was built by and for men. It was not built for women. We don't spend money on women's health. We don't spend money on women's research. And that's why this particular study that I mentioned, the Women's Health Initiative, is so disappointing. We still follow some of the things from it because it did give us some good data, but it also gave us some really, bad data based on what happened. But what do we know now, newer things, is that the sooner you start estrogen, the longer you live, the better your heart outcomes are, the better your brain outcomes are. And so we can always do a low dose of estrogen for somebody who is starting to have some symptoms, for a woman who's having symptoms.
Yeah. To
I mean,
alleviate
the main
all
thing
this.
is to make sure you're done having children. I mean, I don't mess with any woman who wants to get pregnant. I don't do hormones for that because that's a whole different, that's reproductive endocrinology, way outside my scope.
Yes. Well, and I'm in that moment right now. I feel like I'm still in full on postpartum, having 2 kids in the last 4 years, like I shared with you. And the other day I cut my 11-month-old's hair to save a piece of hair and had a mental breakdown and was like, okay, I'm still postpartum. This is okay. You're okay. Nothing happened. But I looked at her. I was like, I'm so sorry. Why did I do that? And it was an interesting transition. But I feel like I'm in my mid-30s, so I'm aware of these things and starting to become more aware of it. And I appreciate the information that I'm getting. But I do see a disconnect from when my mom and even some of my older friends and what they were the information they were receiving and things like that. And so it's interesting how much things have changed. And you really hit it on the point. That study really did mess everything up.
It really did. It messed it up for a whole generation, actually. So my generation, I'm 61, we did not get offered hormones.
Yeah.
And, it took me studying for a bunch of, doctors are lifelong learners, right? That's all we do. We read and we study, and we're always reading studies and learning new things. But when I started going through menopause and realized that hormones weren't an option, it was like, okay, what can I do? And that's when I really dialed in my diet and I dialed in my exercise. But for me, I was never able to lose the weight after I had my baby. And my baby was born in 1993.
Oh, wow.
And
Okay,
the hormonal shifts that happen after childbirth are major.
Yeah.
And I mean, it wasn't for lack of trying. I did, and I just kept on trying and failing and trying and failing. And so I think there's an opportunity to also talk about the fact that we have drugs now that will help us drop that weight and keep it off. Whether or not we use it forever, it depends. GLP-1s are supposed to be used forever, but some people can fix their metabolism and not have to. Especially younger women, I find that who are of childbearing age who want to lose some weight, they are able to get on the GLP-1 and lose some weight and then maybe come off of it and keep it off, which is super exciting.
Yeah.
That we have that option, because before there wasn't an option. You could take phentermine for a while, but then you'd feel speedy and then you come off of it and you just gain weight again.
Yeah. Which makes it so much harder. And then that adds on to the mental side of things and everything else.
Yeah.
Yeah.
Without question. And the problem with obesity is that it just causes so much inflammation everywhere else in the body. Loss
Yeah.
of estrogen causes inflammation. And so it's not, what we hear when we go to the doctor. So we'll say, I don't feel right. And the doctor says, you're just aging.
Yeah.
Okay? I hear that all the time. You're just aging. Well, it's not the doctor's fault, because they didn't get any training in menopause, right?
Yeah.
But when a man goes to the doctor and says, I'm not having nighttime erections, I'm not waking up with an erection,
Oh,
what
yeah.
happens then? They get put on testosterone.
Yeah.
It's FDA approved.
Yeah.
There's no FDA approved testosterone for women, even though it's been proven to help with libido and help with muscle mass and help with body composition, weight loss, mood, and motivation. And then on top of that, bone health, brain health, all the things. So these three main hormones of women are, estrogen, progesterone, and testosterone. These are the ones that we can replace. It's just very frustrating because the system wasn't built for us. It was built for men, by men.
Yeah. Well, and I feel, being at the age that I'm at, I have some awareness of menopause, but when you brought that up and thinking back to when my mom was going through it, I feel like we were very ignorant because we just kind of looked at her and it was like, oh, you're just having a hot flash. It's whatever. And it just kind of got like brushed aside. And it's like people are becoming more aware of the hormonal changes through having puberty as a female and a male. And then also when a female has a baby, and then there's some connections that they're saying males also go through some changes mentally and things like that. But then it's like, the menopause, that next stage, just seems like it kind of got forgotten about or excused in a weird way. And like thinking about memories of when my mom was going through it, like there was even herself when she talked about it, it was just kind of like, oh, that's what it is. And it's interesting having that as a memory where I'm like, why are we so focused on these other such big hormonal changes and really what it's doing physically and also like on our anatomy and everything like that, and this one area just kind of got forgotten.
Yeah, it's funny because every generation that goes through menopause feels like nobody's talking about menopause.
Yeah.
But Gen X is going through menopause now.
Yeah.
And Gen X is not a quiet generation.
No.
Gen Xers are like, F this, I don't want to live like this. And they're demanding some answers. And that's where some of these big menopause doctor influencers are really getting out there. I think also, something we have to remember is that when women lose estrogen in menopause, you can get something called the genitourinary syndrome of menopause, which
Okay.
is where the tissues of the vagina start to atrophy. That includes the clitoris.
Oh,
and so without estrogen replacement, and you can safely do vaginal estrogen for just about any woman, that will help regrow the tissue. It'll help with painful sex. It'll help with lubrication problems, and it'll help with orgasm issues. And so it's very important to get vaginal estrogen. And also as women age, so as they age and maybe end up in assisted living or something, if we can give these women vaginal estrogen, we can prevent urinary tract infections that can kill them.
Yeah, that's amazing. My grandmother actually passed away from a urinary tract infection. She ended up breaking her hip, got pneumonia, got a
Yeah.
urinary tract infection, got pneumonia again, then got a urinary tract infection. And it just was so much her body was unable to heal. And she got an infection in the hip area, and it ultimately did take her life.
But imagine if your grandmother had been given hormones.
Yeah.
Because what we see is that when you start hormones right around the menopause transition, perimenopause, the bone health is better, the brain health is better. We have fewer fractured hips. And the data from fractured hips is, women or patients will live for about 10 years after a fractured hip.
Yeah.
But it does decrease lifespan just to have a fractured hip.
Yeah. Ugh. Well, and the interesting thing that's coming to my mind, and I feel like I grew up with men, so I feel like I'm sometimes it comes into play, but I feel like it's very interesting since we live in a world where males kind of directed this industry in the medical world, and a lot of females help that part of the males. You'd think that they would want us to feel better and want us to be feeling better down there so we could have sex and could be more upbeat and better and more nurturing and those kind of things. You think that that would be an area that would be touched on, not just overlooked.
Well, it doesn't happen to them.
Yeah, yeah. So they
Right?
can't
And so
understand it.
when you're in a society that is focused on one gender only,
Yeah.
the needs of the other gender are not important.
Yeah.
And so it's hard because we've been marginalized for so long living in a
Yeah.
patriarchy.
Yeah.
Whether that's going to change, it might, but it might not. I don't
Yeah.
know. But again, women were taught, and I don't know about, because I'm in a different generation from you, because I'm about, almost 30 years older than you. But when I was growing up, all my brothers were taught to, go out and lead and do stuff. And I was taught to, you're supposed to cook and you're supposed to serve. And that was the role that I was supposed to fill. And of course, I always bucked against it, and I played with the trucks and
Yeah.
that sort of thing. I climbed the trees.
Yeah.
I ran the races. I beat the boys. All that stuff. Okay. But that makes me an outlier, right? Because I wasn't fitting into the box that they were trying
Yeah.
to put me into.
Yeah.
I think now, hopefully most people in your generation are not trying to do that with their girls.
No.
Hopefully, we still have some of the, the religious right folks who want to keep people into those boxes. But for the most part, I think that we see a lot more freedom among your generation and the generation coming after you, with freedom of sexual orientation, freedom of expression, freedom to just kind of be equals. And so we'll see. We might get to a point where we're considered equals. We might not ever. Remember that ERA was defeated by a woman. So
Yeah.
it's
It'll be interesting to see.
It will.
Well, we dove in right away, but I wanted to kind of take a step back and chat a little bit. You did build a successful surgical practice. You shared that you did close it, but what really led to that shift besides you were saying it was around COVID that you closed it? Is that correct?
Yeah, it was COVID. Walking into a hospital felt like walking into a prison.
Yeah.
Just because of all the checkpoints and stuff. And that was not how I wanted to feel.
Yeah.
And so I just was done. I don't know. I just didn't want to do it anymore. And all surgeons stop operating eventually. So at some point. And I actually thought I was going to leave surgery behind. I thought I was going to leave medicine behind altogether.
Yeah.
And I was burned out. I was sad and had to kind of figure out who I am. And about 2.5 years into my break, I realized, oh, I'm a doctor.
No.
I can do doctory things that don't involve surgery. I don't have to use a scalpel. And so I had an identity shift, which was really important for me.
Oh.
And in that identity shift, I was like, well, what's out there? What can I learn?
Okay.
And then I turned on my learning and got boarded in obesity medicine, took the lifestyle medicine certification, and put those to work so that I could help more people, primarily women, get the help they need during this transition. Because at the end of the day, there's just not enough of us out there giving the right advice.
Oh, I agree. Well, I appreciate that. I love that that was the transition, and I'm happy that you're at this space because I can tell that this is really what you're meant for, and just the education and also the space that you create for women is so important.
Oh, thanks. Yeah, it's really, I mean, it's really good. I think that we need a place to go where we're going to be heard
Yeah.
and someone's going to explain like
Yeah.
what's really going on. Because
Yeah.
at the end of the day, it is so common when you go in to see your doctor for that 7-minute visit and you've got a litany of complaints and they only get to one, and then you say, well, I got this, and this. You're like, well, that's just aging.
Yeah. Just get dismissed, which is not okay. Yeah.
It's not okay, but it's very common.
Yeah. It is very common. Well, and then it's like I've been dismissed like that in certain situations, and it's like, why did I even go there? I could just figure this out on my own. And then Google is the worst place to look for things because then you
Google,
self-diagnose yourself.
right? Google and ChatGPT.
Oh my gosh,
Yeah,
yes.
I mean, ChatGPT is probably a little bit better than Google, but even so, it's still not.
No.
It's not. It doesn't replace speaking to somebody who can actually listen.
Yeah. Well, and one thing that I know in my practice is sometimes we hear things differently or people express things differently, but it takes a minute to get to the root of really what their concern is. And so having that conversation with you versus having someone self-diagnose themselves, they could be completely misled of really what's going on. And it could go down a rabbit hole of so much stress.
Well, that's confirmation bias, right? It's
Yeah.
it's the
Yeah.
same thing that led us to withdraw hormones for a bunch of women can lead us to go to the doctor and say, I know it's this, I know it's this, I know it's this. And
Yeah.
that's where it's so important to have a doctor who's going to listen to you, partner with you, and talk to you about what's really going on and treat your symptoms.
Oh, that really is. I love that. So you've been working with women in midlife that are going through menopause. What I really want to know is what signs should women pay attention to in their skin and body that indicates that something might be deeper and might be going on internally that they should reach out to a physician to get some advice for?
Yeah, so I think, what happens is we start to lose our estrogen is collagen doesn't work as well. And
Okay.
so then we start to see more wrinkles.
Yes.
And I don't have as bad now, but I when I was younger, I actually had these big jowls here. Okay,
Um,
probably about 2 years ago, and what made a huge difference for me was estrogen face cream
oh my gosh.
that's
Amazing.
prescribed, and I put it on my face every day.
I love
And I
that.
mean, I'm still, I know I look my age. I don't care, right? I'm 60 years old. I'm happy. I'm happy that I'm 61 because if I weren't, I'd be dead, right?
Yeah.
So, but
You have great
the
skin though.
thank you. The estrogen face cream made a huge difference for me. And I'm not one who ever had like a facial routine. I'm not big at that. I've had Botox maybe twice in my life. It's just not my thing. Okay.
Yeah.
But the estrogen face cream just gave my skin more collagen. Now, do I eat protein and drink a lot of water? Yes. But I would say that if you're starting to notice that you're having saggy skin, or if you start noticing that you're having joint pain or a frozen shoulder, that's when it's time to go talk to your doctor. But yeah, estrogen face cream is fine now.
Yes.
It's estrase, not estradiol, or it might be estradiol. I think it's estradiol, not estrase, because one of them you can get over the counter, the other one is prescription. And it
Okay.
has to be, you can't use vaginal estrogen on your face.
Yes.
It's
Good to
super
know.
important to know that because of the preparation. You want
Yes.
it I use a compounding pharmacy for myself for my estrogen face cream, and it comes in a base that is good for the skin.
Amazing. Yeah.
Yeah.
That's amazing. What you just made me think of a memory. So I did permanent makeup when I was living in Denver, and one of the stories of a woman that had been using preparation H of her eyes went and got eyeliner done, and the preparation H will actually suck the pigment into the eye area,
Oh,
and it
yeah.
creates a black eye that you're not able to, it's really hard to remove that pigment. And so it was this like very scary moment, but it became like a non-negotiable on my protocols and all my forms. It was like, are you using preparation H? And I would scare people. And I had one person who, towards the end, I told her that story and she's like, okay, I have been using it. And she was still wanting to move forward. And I shared with her that. And she's like, oh my gosh, but it's because it sucks all the moisture out and shrinks the blood vessels. So that tattoo ink just gets sucked into everything. And it was really crazy what
Yeah,
people
that's
put on their
crazy. It's a
face.
vasoconstrictor. I mean,
Yeah.
it's used for hemorrhoids.
Yeah.
Oh my God.
Yeah. So that like
Um,
blew my mind where I was like, oh my gosh, that story, like I'll never forget. And I was in my 20s. I was like, oh my God, what are people doing in life? This is what I'm going to deal with later.
I think the first time I saw anything about preparation H being used on the face was on some TV show
Oh,
with
maybe
Kristen
that's what
Chenoweth.
it came out as. There was like someone on TV talking about it. And I mean,
Yeah,
it worked, but there's way better products that are created for the facial area that we should be using.
that's crazy.
Yeah. Ugh. Awesome. Well, I would love to know. So there's so much pressure in the world and right now to stay young and to stay ageless. How do you feel, or how do you help women build a healthier and more empowered relationship with their aging as they're going through menopause and getting older?
Well, I think the first thing is to throw all those standards out the window. Those are
That-
standards that were built by men for men,
Yes.
right? It's not realistic. Like normal people aren't billionaires,
Yeah.
right? Normal people aren't Kim Kardashian. Is she beautiful? Yeah. Does she pay for it? Yeah. Right. So I think that's the number one thing. It's like not everybody can afford a makeup artist to come to their house and do their makeup every day.
Yeah.
So we have to start with the fact that anything on media is not realistic. And
Yeah.
we have to accept ourselves where we are. So we start with that. And then, in terms of confidence, right? When in menopause, it's so easy to gain a lot of weight and to feel bad about yourself. And so we have things that can help you. Like we can give you hormones, we can give you GLP-1s, we can, and once you start to lose weight and once you start to see some progress, then the confidence comes back. You start to feel
Yeah.
like yourself again a little bit. Once you get the hormones right, then your brain starts working properly again. And that's where you start to feel like yourself again. And so that's really important. But I think of all the things, one of the things that's most important as we age is to pay attention to how we speak to ourselves.
I love that.
Regardless of any medicine, regardless of any beauty standard, if you have a voice in your head that's mean and talking to you poorly and meanly, then you're going to, you kind of reap what you sow. So it's really important to kind of get that negative voice and learn how to talk back to it and say, thank you for trying to keep me safe, but I'm going to go over here.
Yes. Yes.
You
Oh, that's so
know,
beautiful. And really just getting, I feel like, comfortable with yourself and learning yourself and honoring that inner voice and knowing that I feel like for me, as I've gotten older, sometimes the inner voice becomes stronger, but I can shut it off and it's not taking over me and it's not determining what I am. And you have to, in a way, for me, I have to talk to it like I talk to a friend sometimes or like my little kids, especially when I'm snowballing and I'm like, okay, you can take a moment. We're going to release this. And I feel a lot better, but I'm still guilty at times of getting down that rabbit hole. But that's very important.
yeah, there's a really great book called The Untethered Soul
Oh,
by Michael Singer,
okay.
where he talks about having this really schizophrenic roommate
Okay.
in your head.
Okay. Yeah,
That
that's really what it is.
it's sitting on the couch next to you, and in one moment it's your best friend, and the very next moment it's like you suck,
Oh my God.
right?
Yeah.
And one of the best analogies I ever read was in that book about how to make friends with the voice in your head. But remember,
Mhm.
if you're having a conversation with that voice in your head, that voice is not you. You are
Yeah.
the observer. And so when you can take that step back, that gives you such a different perspective because who is seeing that voice? Who is having the conversation with that voice? It's
Yeah.
not you.
Yeah.
Okay. I
That's
know that's
beautiful.
meta, but
No, I
it's
love
it's
that. That was beautiful. I appreciate that.
it's important, I think the younger you are to get to a point where you can understand that um you can direct that part of your life. You can direct your thoughts, you can direct your dreams, you can direct your destiny by changing how you choose to think.
Definitely. I agree. And it's a hard one to work through, but yeah, it's amazing when you do realize that.
Yeah.
I love that. Well, this has been wonderful. We're getting towards the end. So we're getting to my rapid fire hot or not series.
Oh,
So
gosh.
I have a couple questions that I'm going to ask you, and then I have one final closeout question.
Okay.
Perfect. Okay, so for hot or not, I'm going to be giving you 10 different questions, and then I want you to rate them what you like. First one is LED masks.
Probably work okay, but I can't. It's outside of my scope. I don't know.
Okay, perfect. Yeah, these ones, some of the questions I'm asking, it's like been interesting because it's in people's scopes, but I like getting people's opinions. And I've been a little shocked by some of the people that I was like, oh, this is what their answer will be. And then they gave me a different answer. And I'm like, oh, whoa, but I've been liking it.
What I would say about LED masks is that if you're going to do a gua sha, it's probably good before gua sha.
Amazing.
Yeah.
Perfect. Well, that answers that. One of the question was gua sha and facial sculpting.
I mean, I think it's about the same as you like using a fascia blaster or something on your face. Does it work briefly? Does it work long term? I don't know.
Yes.
I've never seen any data.
Yes. Yeah. Can we go down a little supplement
Yeah.
realm?
So there's a lot
Great.
of common supplements that are used in menopause.
Okay.
One of the most common one is something called St. John's wort. And
Yeah.
it's supposed to help with hot flashes, but it has lots and lots of drug interactions. And so I always recommend speaking with your pharmacist first if you're on any sort of drug. And
Okay.
even with any supplement. And so there's some newer so menopause is like this new gold rush that's happening right now.
Yeah.
And there's a lot of menopausal predatory marketing out there because it's a tough time in women's lives where they're really feeling down. And it's important to do the research to work with somebody that you really trust. Are there supplements out there that can help? Yeah, but are any of them evidence-based? Not really.
Okay.
So if you're going to do supplements, I would say do things that are going to help with your sleep. Magnesium glycinate will help with sleep. 2 capsules at night before you go to bed. Make sure you have adequate levels of vitamin D because vitamin D is truly a hormone modulator. It's a hormone and a hormone modulator. That'll help with your immune system and your skin health. Collagen is needed for everything, right? It's needed for your skin and for if you have a wound, any sort of wound healing. So supporting your collagen by getting enough protein, high quality protein in your diet.
Yeah.
So it's omega-3s, fish oil, that kind of thing, making sure you're getting enough water. Those are all like things that are almost free, if not free.
I love that. That was great. Perfect. Well, I'd love to know, what is one ritual that you can't live without?
Sleep.
Yeah.
Yeah. I mean, I worked for 20 years as a surgeon and I did a lot of call. Like I would have upwards of 10 calls a month.
Oh my
where
gosh.
I had to get up and go to the hospital in the middle of the night. And so one of the driving forces for me to close that practice was I just wanted to sleep at night. I wanted the luxury of sleeping through the night.
Yeah.
Sleep is probably the number one thing you can do for your mental health. And the problem is this guy right here. Okay?
Yeah.
And so it's really important to put your phone down at least 30 minutes before you go to bed, turn it off, and listen to a book or read a real book and put the phone far away so that you're not scrolling, because TikTok and Instagram Reels and Facebook and all the things, Pinterest and whatever else is out there now, Snapchat and Truth Social and all the things, very addictive. And it's easy to get stuck in a rabbit hole and then not get your sleep and sacrifice that and then feel crappy the next day. The other thing I would say is stop drinking. Stop drinking. Alcohol is poison. There's no safe amount of alcohol for humans, and it's going to disrupt it disrupts everything, but it disrupts your sleep most of all.
Yeah. Well, and sleep is so important, and definitely with hormonal changes and what you're saying, just the fogginess and what we can do now to help us sleep. Sleep is definitely, I think, one of the number one.
Yeah, sleep and hydration without question.
Yes. Amazing. Well, thank you so much. This has been great. I would love to know, where can our listeners find you, follow you, or hear from you, or reach out to you if they'd like to connect with you more?
So I'm on Instagram at Dr. Michelle Gordon. That's spelled out DOCTOR, Michelle Gordon. And I'm on Facebook at DRM Gordon and TikTok at DR Michelle Gordon. Although I'm not doing videos on TikTok yet. I'm still pissing people off with obesity truth. It's pretty
Oh my
fun.
gosh. I love that. That was amazing.
Yeah.
Thank you so much. This was great. If you are wanting to find her more, we are going to have all this in show notes and all of the links for you to follow. Thank you so much.
Sorry, one more thing.
Yep.
You can find me at drmichellegordon.com and you can book an appointment right there.
Oh, perfect. I love that. Thank you so much for being a part of this space and for listening to today's episode of Beauty Talk Confessions. I wanted to take a moment and recognize our amazing sponsors, Prickly Bear, a desert-curated post-hair removal skincare line with pre- and post-care products created to support healthy skin beyond the treatment room, launching this summer. If this conversation resonated with you, make sure to follow the show and share it with someone in the beauty industry. Staying connected is how we grow, learn, and support each other. You can also follow us on Instagram at Beauty Talk Confessions and Prickly Bear for updates, behind the scenes, and more conversations like this. And if you have a moment, leaving a review helps this podcast reach more people who need this conversation too, and it would mean the world to me. This is Beauty Talk Confessions, and I'll see you next week.